flexibility. I do tend to have like a little roll or something under their knee. I'm okay if you did this perfectly in extension, okay? I'm just sort of setting myself up because I know I'm probably going to do some other stuff with that knee. So you want to make sure you've isolated the patella. We're going to make sure that it can move medially. You see how it punches out so much? It should really move half the distance outside of its range. And then you're going to push it laterally, and then I'm going to push it down and poke it right through the inferior and superior. Because she's in a most extension right here, it's just floating, so it should move nice and easy. This is where when you get post-op, this doesn't move very well, and that's your job to do the scraping, the soft tissue work, the joint mobs, to get all of that back, okay? So then next we've got posterior glides of the tibia. So what we're going to do, you guys already probably know this, you could do a very general posterior glide. You'll stabilize with one hand, you'll take your other hand right over the tibia, lean over it so we get that nice force that's going right into the tibia, and then you're going to put the pressure posterior glide. I'm taking everything now here that's in my hand. Tibia, fibula is coming as well, and it's moving on the femur, okay? So that's a very traditional one that you guys probably have learned. If I flip her over and do the opposite, where I do an anterior glide, you guys have probably already been taught that. That's a general technique that you usually have, okay? So there's that anterior glide. Usually though, when you get into an anterior glide, if you want to flip, let's move this stuff for her too. You'll want to make sure to move whatever block you have down by the foot and ankle. Now, usually this is going to be too small. I'll stack a couple pillows or a bolster because you need this area free to do your mobilization. So now your mobilization is going to look like this. So the force is going to come from my arm into her leg doing an anterior. I'm taking everything with it. You have to take up the slack to get through the calf, and then you got to get into the posterior tibia. Okay, and that's more of the anterior glide. Okay, so we'll flip you back, Eugene. Okay. Posterior glide of the femur is an alternate way that you can get knee extension. So if you felt like you're not getting enough one way through the tibia, if you just reverse your direction and go through the femur, you'll stabilize the tibia and you'll work through the femur. It's another option for you, especially if there's an incision there that maybe you don't want to push through, okay? This is the stuff you might not have learned yet. So the fact that you can separate out the condyles. So if I want to take an anterior approach, okay, and I am on the lateral condyle and I push posterior, okay, that is going to help restore what?
External rotation.
External rotation and extension, right? They go together, the screw home mechanism, right? If I do an anterior approach from the medial condyle, I need to stabilize the lateral and put my mobilizing hand on the medial side and push anterior, okay? That's going to restore our flexion, internal rotation, right?
We push anterior?
If I start push posterior, from anterior to posterior, AP, okay? So you've got AP on the lateral side, I stabilize, and I push this is my mobilizer, and I'm pushing through the tibia on the lateral condyle. Here I'm pushing through the tibia on the medial condyle. It's going to give us rotation. So if you know you've got a rotary issue, not just flexion extension, and you know there's a component of the rotation, then you can get it. If you know you're just trying to get either flexion or extension, but you're having a tough time isolating it by taking the whole thing, you can get more specific now. You can do, to restore your flexion, okay, so follow me, you're going to do an anterior AP glide on the medial condyle. If I then flip her over or just flex her, and I give her a little, my bum on her foot, If I stabilize and I pull from posterior to anterior on the lateral, that's internal rotation and flexion, right? So you can do them at the same time. One goes this way, one goes this way. So it's just being more specific. If I want to do my typical posterior glide on the lateral from AP, and I bend her or I flipped her, and I stabilize lateral, but I pull medial through, you got to get through all that calf. If I pull the tibia from P to A, that's external rotation with extension, okay? So it's just getting you a little more specific than taking the whole thing if you're having a tough time getting the mobility. It's just another advanced move you can do, okay? Okay, great. So those are those tibial moves.